All right, good morning everyone and good afternoon. Thank you for joining us today and welcome to the webinar. This is the third of our three-part webinar series on transportation. So I want to welcome those of you that are joining for the first time, and to anyone that's joined us for all three. I really appreciate you on your participation and attendance, and I hope that it's been valuable so far. This is also as part of our webinar series, we're also doing office hours. So even though this is the last in our series, stay tuned for the office hours that's coming a week from now. And thank you for joining us. So my name is Liam Spurgeon, and I am a project manager, and I'm here with my colleague Sonia Lee, who's a senior manager at Health Outreach Partners. And Health Outreach Partners, we commonly refer to ourselves as HOP. We're a national nonprofit, and we're based in Oakland, California. We've actually been in existence since 1970, but we've been since 2000, we've been in a national model where we provide training and technical support to community health centers, to primary care associations, and really any safety net health organization or community-based health nonprofits. Our mission is to build strong, effective, and sustainable health outreach models. So in addition to our work around transportation, we also have quite a few other resources, manuals, toolkits, and a lot of other webinars that we have recorded on our website. So feel free to check out our website. It's outreach-partners.org. For everyone that is attending today, we are using the GoToWebinar software. So hopefully you're seeing on your screen right now a little snapshot of what the control panel looks like. If you have any technical issues that you're experiencing during the webinar, please call 1-800-263-6317. GoToWebinar has a technical support line that they can work through any of those issues with us. We'll also be monitoring the questions panel. So if you have any questions that we can respond to immediately, that'll actually be me for the majority of the webinar that's responding to those. So you can locate that question box on your control panel where you see it on the screen. And if you have any questions for our panelists or about any of the information that you're hearing today, you can ask those questions there at any point during the webinar, and then we have a few minutes at the end of the webinar for Q&A. And just remember that if there's any questions we don't get to, we'll also save those questions for the office hours in a week. And I just want to remind you all that this webinar is being recorded, and so we'll send out a copy of the slides, a link to the recording, and any other links or resources that are mentioned in a follow-up email, so stay tuned for that. And this is just a quick summary of what we've covered so far in our webinar series. The first was titled The Need for Research and Data to Address Transportation Barriers, and that was at the end of February. And then the second was the role of ride-sharing services in addressing transportation barriers. And then, of course, today, our topic is addressing the transportation needs of older adults, and we have a couple panelists that are going to be sharing their experience and expertise on this topic. Again, if you'd like to see any of these recordings of these past webinars, I'll share out that link in the follow-up email so you can get that information. So for today's webinar, the learning objectives we have is that by the end of the webinar, participants will be able to understand the unique transportation needs of older adults, identify at least one intervention used to address transportation barriers for older adults, and describe the role transportation access plays in supporting older adults access chronic disease management, decrease readmissions and ER visits, and address social isolation. And we always like giving a quick snapshot of who's on the webinar. It kind of, this can feel fairly impersonal, so understanding who else is out there, and also just the broad interest in this topic has been really interesting. Transportation is a topic that we found is interesting across a lot of different sectors and across a lot of different roles within the organization. So we had actually over 95 participants. When I wrote this up, there was 95, but I know we've gotten a few more signed up. And it's really interesting the breadth of roles that everybody has. We have community health workers, care coordinators, and case managers, lots and lots of program directors, whether that's on the health side or on the transportation side, mobility coordinators and transportation specialists, quite a few executive directors and CEOs, also folks on the clinical side, quite a number of registered nurses, and then we also have grants managers. We also asked you all in the registration who collects patient data on transportation currently, and about a little over a quarter of you do, and about half do not. And for those that do, the main ways that they were doing that is through patient surveys. Some of you ask questions of your patients just during the appointments, and others are tracking no-shows and also why those no-shows are occurring. For those that are collecting social determinants of health data beyond transportation, a lot more of you are, and some of the social determinants of health you're tracking are food insecurity, housing needs, insurance eligibility or insurance concerns, and then a number of you are using the Prepare tool, which is really great to see. Finally, for those of you that are currently engaged in transportation solutions, which is a little under half, some of you are using ride-sharing apps, which is really cool to see, especially after our last webinar. Many have volunteer drivers or provide their own door-to-door transportation. Some have bus or taxi vouchers or give gas cards as reimbursement. And then there was actually one group that I thought was really interesting, that they're also doing a lot of local policy and advocacy work with local government to try to build awareness around this issue and discuss ways to address it through public transportation routes or increasing walkability and other issues in the community. So really encouraged to see that and grateful that everybody is submitting those responses. And so with that, I'm going to pass it off to Sonia, who's going to give you a little bit of an overview of our topic.
Great. Thank you, Liam. So as Liam mentioned, this is the final webinar of our transportation series, and we wanted to conclude the series looking at older adults and the impact of transportation barriers on this specific population. We know from the literature that transportation barriers affect many different groups, such as women, those with less formal education, communities that are low income, as well as communities of color. However, we chose to focus on older adults because we felt that this is a topic that is relevant to all of us. Aging is a normal part of all our lives, and many of the issues we'll cover today are things that our patients, communities, and we ourselves currently or may face later on. We recognize that aging is not a disease, but that it does increase risk for various chronic conditions and other possible adverse health outcomes and compromised quality of life. So we thought it was important to highlight this specific population and discuss some ways to address their needs around transportation. And just, for the sake of our discussion here today, when we say older adults, we're referring to those 65 years and older. So just quickly to review, we know transportation affects every aspect of our lives and daily routine, including where we live, work, spend time, shop, and go to school. It has an impact on where communities are located, on growth, and on physical and social mobility. And it helps connect us to each other and, reduce some of that social isolation. But we also know access to transportation is not equal, and it remains a barrier for many. And we're finding that it's not primarily in rural areas, but in fact, we're seeing it more in suburban areas as well as in cities, mainly affecting low-income and vulnerable communities, where issues of gentrification, high cost of living, and lack of affordable housing are pushing folks outside or on the periphery of cities, where transportation options, especially public transportation, may be limited as well. So really, there is a strong need for convenient, affordable, and accessible transportation. Again, when we're considering services that people need, let's look at healthcare specifically and how transportation barriers impact access to care. And we see it has many implications along the spectrum of care, from delayed or missed appointments, interruption of care, inability to really get to stick to any kind of care plan or your medication schedule as well, any kind of follow-up, poor health outcomes, and an increase in use of emergency care rather than primary care. So when we consider older adults and what transportation, or even broader, the importance of maintaining mobility means for them, by 2020, it's estimated that 1 in 5 Americans are expected to be age 65 or older, and I believe by 2030, older adults will make up about 20% of the U.S. population. Mobility, which we define as this ability to move around effectively and safely in the environment, is really fundamental to their health and well-being. We know that older adults lead active lives and they drive and they use public transit. But as you age, this can become more challenging as you become at a higher risk for physical disabilities, cognitive impairment, social isolation, mental distress. Older adults we're seeing are carrying a significant burden of chronic conditions, which, can result in loss of independence, just diminished quality of life, and even death. Evidence really does show that limited or impaired mobility exacerbates or leads to adverse health outcomes. So being mobile and able to engage in activities that support active and healthy lives, as well as having access to care and other services, is more important than ever. Older adults want to maintain their independence. In fact, according to the AARP, 90% of older adults intend to age in place in their homes and communities. Therefore, safe and accessible transportation is a top concern of older adults, caregivers, and their communities. And then when we're thinking about barriers, first of all, although driving is still a viable option for many older adults, the risk for accidents and crashes increases among those aged 70 to 74, and the risk is even the highest among those who are 85 years and older. Yet we also know that vehicle access is a positive predictor of making medical appointments. And then public transit is also an option, but can be less available and accessible, especially in rural and suburban, and also we're seeing that in the cities. And also those managing chronic conditions can find taking public transit challenging as well. So there is a need to increase transportation options for older adults. We know having regular access to a vehicle is often the top preference, and by regular access we mean having your own vehicle or getting rides from family, friends, and caregivers. And we want to acknowledge the important role that caregivers play in transportation, and in fact 78% of caregivers either provide or arrange rides. And data shows that caregivers provided 1.4 billion rides per year to older adults. There are taxis and ride-sharing services, but they can often be costly, and navigating technology with smartphones, things like that, can also be a challenge for older folks. But there are programs that provide subsidized taxi vouchers or ride-sharing services, and we're really lucky to have one ride-sharing service today on our webinar who'll share a little bit more about their program with us. There are also volunteer transportation programs as well as transportation voucher programs where organizations often provide fare assistance to qualified individuals, and they can purchase vouchers for transportation services at a reduced rate. There's assisted transportation. This is really providing that door-to-door support for those who may not be able to use public transportation due to a disability or another condition. And then for those who qualify, you have non-emergency medical transportation under Medicaid. And we also recognize Medicare offers transportation for like ambulatory services, but that's very limited as well and for specific cases. And of course, there's paratransit, which serves those with disabilities, again, for those who can't use public transit. So as you can see, there's a variety of options, but it doesn't mean that they're all available and accessible for everyone. And oftentimes you have to meet certain criteria. So we need to continue to raise awareness of this existence of transportation barriers for older adults so that we can ensure that we can enhance their ability to live more independently within their communities. So with that quick overview, I'd like to introduce our first panelist, Dr. Christine Reedy, who's from the National Center for Equitable Care for Elders. She's one of our fellow HRSA National Cooperative Agreement TA providers. Dr. Reedy is a behavioral scientist and the Delta Dental of Massachusetts Associate Professor in Oral Public Health and Epidemiology at the Harvard School of Dental Medicine. She holds an MA and a PhD in psychology and an MPH in health services from the University of Washington. As I mentioned, she is the PIPD for the HRSA-funded Training and Technical Assistance National Center for Equitable Care for Elders. Additionally, she's also the lead PI and PD on a HRSA-funded cooperative agreement titled Center for Evaluating Integration of Oral Health into Primary Care Training. Dr. Reedy draws experience from her extensive work with vulnerable and underserved populations and current work on integration within primary care. So with that, I'd like to welcome Dr. Reedy, and I'm going to turn it over to you.
Thank you, Sonia. So you can actually advance to the next slide. Thank you. So as Sonia had mentioned, we are definitely seeing an increase in the older adult population. The United States population continues to experience this incredible transformation with over 10,000 baby boomers turning 65 every day. This age wave, or as some of you may have heard referred to as the silver tsunami, is expected to continue well into the next century. The age 65 and over population has increased from 35 million in in the year 2000 to over 44 million in 2013, showing a almost 25% increase. And it's projected, I should say, to more than double to 98 million in 2060. And you can see in the figure adjacent that if you look across all of the states that you come from, there is a large number of states where they have 100% projected growth of their age 65 and older population. And so addressing any transportation issues now within this population will be important for our future. Next slide, please. So when asked to identify the top 3 challenges that their communities face in meeting the needs of or planning for older adults, local governments ranked transportation as their second highest concern in 2010, right after the financial issues. However, 5 years earlier, transportation was not even in the top 3. So notably, transportation has risen from a mix of other concerns, not within the top 3, to become the number 2 identified challenge in communities. And the survey findings suggest that communities increasingly recognize the impact of inadequate transportation options on older adults, hobbling progress in connecting them with services, as well as opportunities for them to contribute back to society. And that transportation is a vital link connecting older adults with their communities and to engage them in a full life with respect to either job or volunteer work, as well as medical and social health services, family, and friends. Next slide, please. So Sonia had talked about mobility in terms of the ability to travel, and mobility can be defined this way in its narrowest sense. An expanded definition can include the ability to travel where and when a person wants, the knowledge of travel options available to them, how to use those options, being able to use those options, and having the means to pay for the travel. And a more comprehensive definition includes the ability to travel to access the desired people and places, the psychological benefits of movement, for example, as Sonia had mentioned, feeling independent, having self-esteem, as well as the physical and exercise benefits, and then the future for potential travel, and particularly knowing that a trip could be made if there was an emergency. Next slide, please. Access to reliable transportation is really a key to both health and quality of life. And driving status plays a critical role in the complex interactions between aging, physical and psychological health, community mobility, and the use of health services. And driving cessation is considered a major loss in terms of social identification, control, and independence. Those with a decline in health status and driving cessation are more likely to have an increase in depressive symptoms and a decline in out-of-home activity levels and community mobility. And the same health conditions and functional impairments that cause a change in driving patterns also limit access to other transportation options, for example, walking or cycling, or even being able to use public transport. And this can further restrict their community mobility. A good understanding of these relationships is required in order to enable older people to maintain both economic and social participation and result in a good quality of life. Next slide, please. Absent access to affordable travel options and limited mobility, seniors face isolation, reduced access to medical services, potentially resulting in negative health outcomes, poor psychological health, and reduced functional capability. Mobility is central to fulfilling needs beyond basic survival, such as social engagement, and low mobility is often associated with a lower level of social engagement in all forms. For older adults, social activities are considered highly important and account for approximately 20% of trips outside the home. Conversely, increased social engagement in older adults is associated with greater quality of life, lower rates of depression, improved cognition, and lower mortality. We also know that seniors who are age 65 and older who no longer drive make approximately 15% fewer trips to the doctor, almost 60% fewer trips to shop or eat out, as well as over 60% fewer trips to visit friends and families than drivers of the same age. Next slide, please. So in thinking about older adults and transportation, the fact is that old age is associated with the onset of medical conditions and substantial functional decline in some individuals. But the myth is that this widespread decline means that many older drivers should cease driving. Next slide, please. So there are certainly data to show that there are some issues in terms of driver safety and medical conditions as red flags. And in this table, you can see on the left side, we have general conditions, health conditions, and some specific examples that aging impacts these different conditions. So I think one of the conditions that most people think about when they think about older adults and being able to get around efficiently is visual impairment. And so certainly as we age, some people can have resulting changes in their vision, as well as changes in their hearing. And then also other age-related changes depending on the area of the body or condition that we're referring to. Next slide, please. The linkage between medical conditions and crash risk, as Sonia had explained, can best be explained by the changes in sensory, perceptual, cognitive, psychomotor, and physical functioning prompted by various medical conditions. And so as a group, in general, older drivers tend to have poor visual acuity, particularly reduced nighttime vision, poor depth perception, greater sensitivity to glare. They have reduced muscle strength, decreased flexibility of the head, neck, and trunk, slower reaction time, and are less able to divide their attention among tasks, particularly with filtering out extraneous stimuli, which makes it more difficult in terms of being able to navigate driving, as well as other mobility issues. Next slide, please. However, it is not age per se that leads to problems with driving, rather declines in driving-related abilities, primarily the results of medical conditions such as Alzheimer's disease and Parkinson's disease, as well as other health problems and medications to treat those conditions that can be problematic for older drivers. Next slide, please. Most older adults will age in place. Again, as Sonia had mentioned, aging in place becomes a big issue, particularly as we have increased projections of older adults in the future. And almost 80% of older adults age 65 and older live in car-dependent communities. A large number of older adults' ability to navigate through their neighborhood by using their vehicle may reduce over time. And so they'll need alternative transport options to driving in order to preserve their independence. The Congressional Research Services noted that naturally occurring retirement communities are often a challenge for transportation and social service providers because they were not designed with the provision of services to older persons in mind. Next slide, please. While driving in one's personal vehicle is undoubtedly convenient, and it certainly is something that most people have done, the best way to ensure continued transportation as we age is to become comfortable with using a variety of options. People often look to family and friends to assist with transportation, but this may not always be possible, particularly as family members move farther away from home. And so community transportation can help stay connected to essential services and other activities. And so when we think about the needs of the the aging population, we should really think about it in terms of a continuum of transport and mobility needs, moving from driving to non-driving, and understanding what needs to be in place in order for the older adults within each of these different transportation or mobility categories. Next slide, please. So for example, in the first category of driving, there are different areas that can be impacted. So for example, strategies and methods for the driver, the vehicle, and the environment, particularly the roadway. And so in terms of the driver, there's tools and resources for older driver safety, such as the Drive Well Toolkit and the Physician's Guide to Assessing and Counseling Older Drivers. There have been changes in terms of the vehicle. One such assistive device is something called a car caddy handle, which attaches to the frame of car doors, and it offers older adults the ability for balance. They can pull themselves out of the car with this handle. And then lastly, in terms of the driving examples, are changes in the roadway design. So thinking about roadway enhancements for being able to moderate a vehicle speed in high pedestrian areas, or using or separating or restricting vehicle traffic in high pedestrian areas to give the drivers a little bit more time if they need to react to a situation. Next slide, please. In the transitioning category, the decisions to stop or reduce driving are often influenced by a variety of factors. One of the most important factors is the status of an individual's health, and the physiologic changes of aging, the pathological effects of various diseases, and the medications used to treat them may impact one's ability to drive. And so when we talk about the transitioning examples, we're talking about an individual's self-regulation of driving patterns. For example, in thinking about the driving cessation continuum. So you may have people who'd make the decision to not drive at night because they feel that their vision is poor. And so if we can approach this as a process and not necessarily as a single directive or event because of the psychological impact of driving cessation. And as we had talked about previously, the issue of the loss of independence and self-esteem. Next slide, please. In the last category, in non-driving examples, because America's roads and automobiles are not designed for the existing elderly population, and because the skills and abilities associated with driving tend to diminish with age, we really need to have viable alternate forms of transportation for the elderly. And this will be continue to be an important issue for years to come. And these are just a couple of areas under the non-driving category. Uber partnering with senior community centers and other advocates, as well as an initiative through the Department of Transportation on Rides to Wellness, where they've solicited applications for from communities to be able to create alternative transportation costs. And I know that we'll talk about that. We'll talk about one specific program coming up. Next slide, please. So two overarching issues related to older adults and transportation facing communities are helping older adults who are able to drive safely to continue to drive. And then for those who aren't able to continue to drive, providing them with access to alternative forms of transportation and mobility support. Next slide, please. So this slide shows a variety of different ways that we can assist older adults on using transportation. I won't go through these in detail, but things from driver training, assessing the vehicle, creating safe streets for seniors so that they are able to move around without risk for falls or other serious issues, as well as also having counseling approaches in terms of travel options, and to have a patient-centered mobility management process. Next slide, please. This is a list of alternate transportation options, and Sonia had mentioned several of these, and they can range from having demand response, something like Dial a Ride, where people can be picked up at different entry points and dropped off, all the way through shared ride services, for example, with Uber and Lyft, taxi services, and then also volunteer transportation programs that could be offered by local nonprofit organizations, and may require a small fee for that. Next slide, please. So wrapping up, the transportation needs of older adults will best be met with a coordinated approach across the transportation continuum, thinking of going from driving to non-driving. And so thinking about how to have safer road users and appropriately managing at-risk older drivers, either through appropriate licensing procedures or developing targeted educational programs, to having safer vehicles, in terms of some of the technological advancements, as well as safe roads and creating a safer and more forgiving road environment to match the characteristics and needs of older road users. And then lastly, improved alternative transportation optionals that are both accessible and affordable, as well as safe and are coordinated so that they meet the tailored needs of older adults in the communities. Next slide. So as the population of older adults grows, meeting seniors' transportation needs will remain a critically important issue, and perhaps the strongest case for making transportation-related changes is that everyone will benefit. Beyond the fact that everyone might need aging-friendly features at some point in the future, the design elements that make communities safely walkable and increase transportation options benefit not only the older adult population, but also benefit younger people today. Next slide. And this is just some websites for additional information. Thank you so much.
Thank you, Christine. That was a really great comprehensive overview of transportation older adults done in a small time that we allotted you. Thank you so much for that. And I just want to remind folks that, this is a lot of information that you're getting, and that the slides had a lot of good information as well as the sources. So those slides will be made available to you at the end of the webinar. And just a reminder, if you have any questions for our panelists, please send them through the question section on your control panel. So I'd like to move on. I'd like to introduce our second panelist, Paige Sweeten, who's from Peninsula Volunteers, and she'll speak about their partnership using ride-sharing services with Sequoia Healthcare District and other community centers around the area. Paige Sweeten is the Associate Program Director at Peninsula Volunteers Incorporated, where she oversees the Little House, the Rosalind G. Morris Activity Center. And in addition to managing the business operations, she's focused on bringing innovative new programming to Little House with the goal of helping seniors in the community stay active and independent. And like I said, in 2016, she helped launch a partnership with Lyft the Sequoia Healthcare District, and other local activity centers to provide low-cost, on-demand transportation for aging adults. So with that, welcome, Paige, and I'm going to turn it over to you.
Hi, everyone. Thank you so much for having me here today, and I'm really excited to share about this great program we've been doing here at Little House. If you want to go to the next slide, it's fine. So I work for an organization called Peninsula Volunteers, and we provide services to seniors in Menlo Park, California, which is located in San Mateo County, just south of San Francisco. We have 4 main programs that really serve a wide need for seniors. We work with Alzheimer's and dementia patients at our Rosner House Adult Day Center. We do Meals on Wheels for San Mateo County, the Little House Activity Center, which is where I run, and then we own low-income senior properties. So as you can see from this slide, the people we serve have a wide range of mobility levels and access to transportation. Next slide. In 2015, we decided, after talking to many of our clients, we needed to address some of the transportation issues that we see our folks facing. We started looking at kind of what the options were currently available within our community. And so those included public transportation, which we do have a bus system and the trains, but our community doesn't always have easy access to them. It can be, several blocks to get to a bus stop, as well as long rides and quite a few transfers to get around. Our public transportation also does a paratransit for both folks with disabilities and older adults, but it's not very well received sometimes within our community. You have to register in advance. There's oftentimes long wait times for them to come get you, as well as if you're not ready to leave right when that transportation gets there, you might get left behind. Private taxi companies, but for many of our clients, those were expensive and in this area, somewhat unreliable. It might take 15 minutes for the taxi to get there. It might take 2 hours, and it would sometimes be hard to know. And then rideshare companies such as Uber or Lyft, but the challenges with that are obviously the technological barrier for a lot of our seniors that don't use smartphones, as well as the cost. So next slide. So we started looking into some possible solutions on how we can start, particularly to get people to the Little House Activity Center, but then serve the greater need for our larger community. So we looked into hiring drivers and running our own shuttle program, whether that's through people using their own cars or possibly driving a bus that we already owned. Problems with that would be kind of an expensive startup cost and ongoing cost we weren't really sure how many people would utilize the program. We looked into the volunteer driving program where volunteers would go pick seniors up and take them either to Little House or their doctor's appointments or other options. But because we already use a lot of volunteer drivers, we know some of the problems with that, as well as it would lead to a lot of internal competition with our Meals on Wheels programs, which does have a very heavy reliance on drivers to drop off the food. So we didn't want to poach any potential volunteers from that program. So we finally kind of looked into leveraging taxi companies, either through a voucher program or possibly using ride shares to provide subsidized rides. So next slide. Being in the Silicon Valley, using rideshare ended up kind of being an ideal solution for us. We were able, right at the very start when Lyft and Uber were looking at doing dashboards to allow people to request rides not through a cell phone, we were able to find out about that and work with some amazing partners to create a subsidized ride program. So the Sequoia Healthcare District is a local taxpayer-funded district that we were able to convince, hey, this is a need, and they believed us and gave us a small $5,000 grant to pilot this program. So the original program would go to 2 destinations, the Little House Activity Center and then San Carlos Adult Activity Center, which is a couple towns down from us. We were able, after several months of working on that, to offer rides to doctor's appointments and dental appointments starting in October 2006. Our system is set up so that all rides are on demand. So basically people call us and we book them the ride here and then. So there's no wait times for buses or ready wheels. And the big thing is people don't have to worry about missing the ride if their appointments run late. For us, we really wanted to create this feel of if you were going to request one of these rides yourself through your smartphone, that's what we want to make it feel like for you. Next slide. So here's how our clients kind of go about requesting a ride. The first thing they do is they pre-register with us, where we can get their home address, emergency contact, some of the places that they might be going to have those addresses on file just for quick reference, as well as their credit card number. We do charge most of our clients $4 one way for the ride, and bill that after they take their actual ride, with the rest of the cost being subsidized. So once they're pre-registered and then they're ready to go onto a ride, they call our hotline number, and a staff member picks up the phone and then books the rides like then and there. We're able to let the rider know who their driver is going to be, their name, what kind of car, and about when the driver is going to arrive. And it's usually fairly accurate on how soon the person's going to be there. Throughout the entire process, our staff keeps an eye on the ride just to make sure that people get in the car, the driver's not having any issues finding them, and then that they get dropped off at the correct location. Like I said before, all rides are on demand, which creates a very good feel of independence and kind of control back in the folks' life. So next slide. So this is just a screenshot of our dashboard of a ride that was currently in progress. So up at the top, there's a little new request button, and when someone calls us, that's the button that we would push and then put in all of their information. The driver's information is up at the top, and then as you go through it, you can see the status of the ride. So if we were just requesting it and they hadn't been picked up yet, we would show like how far the driver is away. You're also able to see the driver's information, what kind of car, and the license plate number of the car. And then this is where, as we're going through, we're able to monitor everything that's happening and keep an eye. So for example, you can see Donna had a driver cancel on her. So we would go through whether that was because they couldn't find her or some other reason, and either re-request the ride or be able to see updated information on when the driver was coming. Next slide. So I just want to talk a little bit about our results and how it's gone so far. This tracks our usage of what's been happening. Unfortunately, the colors didn't show up. So the activity line is the one starting in May 16, and that's going to Little House and our partner activity centers. And so we've had fairly steady increases, especially along that, with some seasonal stuff. You know, when people are on vacation, we don't get as many ride requests. The line that falls slightly underneath it, but then takes over towards January, February, and March are the number of rides we offer to medical and doctor's appointments. And that really has grown in the last 3 to 6 months exponentially. So we're ended up averaging now about 700 unique rides each month. Next slide. And then just some information about our users. So to date, we've had 279 unique users with over 6,100 rides. 72% of those are women and 28% are men. Most people travel on average, if they're going to an activity center, less than 3 miles and about 4.3 miles to the doctor's office. The average cost per ride is $12, with $4 of that being paid for by the rider and the rest subsidized by our funders. And then what I think is really interesting is you can see that also the colors didn't show up on this is the number of the ages that people use it. So about 45% of our riders are ages 80 to 89, and 20% of our riders are 90 plus, with a decent percentage in the 50s to 79 range. And in general, all of our riders really feel comfortable across the age range using the service once they've used it once. Next slide. So some challenges we faced doing this program, we recognize that this program isn't going to work for every situation. Riders need to be able to get in and out of the car unassisted or have someone with them that can assist them. This is really partly just the nature of using a third-party service. A lot of the drivers, they're not going to be trained to help get someone into a car. So it does limit, if someone's in a wheelchair at this point, we're not able to help give them a ride if they can't get into the car themselves. What we have found is that most drivers are very happy to put a small transport wheelchair or a walker or cane in the trunk of the car for someone so that can get transported with them. Additionally, it's a curb-to-curb service. So some of our clients that might have dementia or Alzheimer's, it's not necessarily a good fit for them because they need to be able to be waiting outside for the car to come get them and get in the car independently. We do have some situations where, a loved one will make sure their person's getting in the car, and then we know they're coming to Little House, and when they're ready to go, we're able to help get them back in the car. But those are really kind of short-term solutions until we potentially move them over to a different program. And then our biggest challenge is actually the geographic area we serve. Because we are funded by taxpayer money, we have some limitations on where we can pick people up at, depending on where they live. And it can be challenging because maybe they just live one town over really close to us, but we don't have the money right now to give them the subsidized rate. As well as we're growing, I think that's going to be the other big challenge is getting enough funding to keep this going for the long term. Next slide. Which brings me into where exactly do we get our funding for this? As I've mentioned a couple of times, our big partner is the Sequoia Healthcare District. They gave us our small initial grant to see would this thing even be successful, would people use it, and how would it work? And then they have given us expanded funding to continue through June 2019 with kind of the idea that we might, if it continues to grow at this rate, we're going to have to continue searching for outside sources. So to address that, because we have been growing so exponentially, we recently received funding from Bank of America and from one of our county supervisors. And then in addition, we are also working on some outside partnerships to provide our service to other organizations that maybe would like to use this but don't have the capacity that we do. So the biggest one is the Peninsula Volunteers properties. That's our low-income housing, and we were able to get a grant from that program to give rides actually 100% free to the folks that live in those property buildings. And then most recently, we've been working with our local villages to provide kind of their overflow ride share options for select clients that they send to us. And then final slide. So this is just some client testimonials. I won't read them to you, but almost across the board, the things that we hear from folks is that it's changed their lives. It's not only helped them be more social and be more active, but get to incredibly important office or doctor's appointments that they might have missed or would have taken a lot more stress and work. I think when we read these things, these are the stuff that makes us realize, like, we have to continue doing this and continue addressing this need, because it's only going to get bigger and become more challenging as we go. Thank you.
Thank you so much, Paige. Thank you so much for sharing all the details and the experiences you've had of this wonderful program. Really, again, feel very honored that you were able to participate in this webinar. And I just want to mention to you all that, we have about 5 minutes left, and we have some questions, but that we will have the office hours next week, and Paige and Christine will both be participating. So if you want more individualized attention from our panelists, I would really encourage you to join us on our office hours, so you can get some of these other questions that you might have answered. Before I move on to our last question, I just wanted to remind you all too, we have some resources designed for health centers, PCAs, and other community-based organizations. We have a QI toolkit that focuses on transportation, some highlights of different transportation models that are out there, and we do have one that is specifically for seniors, and we have an info book just on some data around transportation. And one last thing, during the registration, you all had a lot of questions around funding, and we just wanted to share a recent funding opportunity with you all, and we'll send that in the email that we send out to you. But the Federal Office of Rural Health Policy and Administration for Community Living and the FTA, the Federal Transit Administration, are providing up to $35,000 grants to up to 20 nonprofits or government organizations to develop and begin implementing transportation programs that meaningfully involve older adults and people with disabilities. And the proposals are due next week, May 4th, but we will send this funding opportunity out to you all in the following email. And last thing, we had a question about, again, the slides will be made available to you all as well as the recording, and we'll send that to you at the end of the webinar. So just to wrap up, we do have a question for Paige. Liam, do you want to read that question out?
Sure. Yeah, I just want to mention, we might just stay a couple minutes over our original time. So if anybody needs to go, that's fine. But since we did have a couple questions, we want to be sure that those can be answered. So first, Paige, we had a question come in about how exciting it is that you can charge as low as $4 for each trip. But the person is interested if you've run into any situations where maybe some more low-income people are not able to afford that cost, and that if you would recommend that that they should still charge even if it's as low as $1.
Yeah, so that's actually something we really considered when we were setting up our original model, is do we just make this free or do we charge people for it? And we do have some people, that couldn't afford the $4 fee, largely those that were living in our low-income housing, hence the reason we were able to actually get those 100% free. So that's really great. We have we can see the fee versus having it free. I think one thing we have noticed is the people that do pay for it are a little bit more conscientious about making sure that they're getting to their ride, that they're out front ready to go. And that was the reason we decided to not make this a 100% free program, is we really wanted people to value it, because at the end of the day, if they don't get in the car, there's a good chance we're still getting charged a cancellation fee for the driver not being able to find them. And so that's why we think, like I said, that even charging as low as $1 would help just kind of encourage folks to take it seriously, I guess.
Great. Yeah, I mean, I think that's a really good tactic, but it's nice that you do have something in place for those that truly can't afford it. Somebody else was wondering, do you have a relationship with Lyft at all as an organization?
Yeah, so I mean, we have a contract with them. The reason we were able to find out about this is because on one of my steering committees, I actually have a community member that works out of the Lyft corporate headquarters in San Francisco. That like happened to be as we were working on this project, found out, oh, you're working on this? This is what Lyft's doing. Let's connect and make these things happen. And then when we signed up, like I said, it was a corporate, we have a contract with them saying, we use your service, we will pay you, you will provide the X, Y, and Z.
Great. Yeah, it's a lot of, this is sparking a lot of questions. Somebody else is wondering, so the person that helps coordinate those Lyft rides, are they also coordinating transportation through other services, like through the health plans?
No. So for us, it's just one of our staff members that actually works at the front desk of our activity center. So what they might do is, if Lyft isn't a good option for these folks, is provide the references to things like our paratransit, other services, but they're not coordinating those rides themselves.
Gotcha. Great. Well, thank you. Thank you for responding to all those questions. We have one more, and I think this one might be a little more oriented towards Christine, about how do transportation programs consider providing support to the caregivers in addition to the older adults?
So that's actually a really interesting question, because as you know, as people age, and particularly in thinking about moving from the along the continuum from driver to alternate transportation or non-driving needs, people become more reliant on caregivers for getting them from place to place. And so there are some resources for caregivers in terms of transportation needs, and I can share those just in terms of how you would navigate with your older adult family member with respect to being in the car, and particularly if they have dementia or another form of Alzheimer's disease or another form of dementia, where there might be confusion, and even just being able to navigate getting them out of the car if they have mobility issues. Because oftentimes what happens if they're at the place where they're no longer able to drive, it might be because of physical limitations. And so being able to even just get them out of the car, and also being safe yourself as the caregiver in navigating them out of the car.
Wow, thank you. Yeah, thanks. And that would be great if you have any of those resources. If you want to share those over with me, I can include those in the follow-up email that I'm sending, along with the slides and the link to recording. So that's actually all the time we have. We stayed over a couple minutes, but I wanted to be sure to get to some of those questions, since we had quite a few questions posed during the webinar. For any of those that are still pending, we had a few questions from the registration and a couple more specific questions that came in at the very end here. I really want to encourage everybody who has more of those questions to join into the office hours next week, so we can talk about these a little further. Just as a follow-up, if you'd like to reach out to our panelists individually, their emails are on the contact screen here, as well as the emails for myself and Sonia. So please don't hesitate to reach out to any of us. Just a quick reminder that we have an evaluation that should pop up automatically once the webinar ends or once you exit. So do us a favor, please, and fill out that evaluation. Let us know what you thought of the webinars. We will be sending out some of those resources, including more info on the funding opportunity that Sonia mentioned. For anybody that's in California, especially Northern California, there is a Rural Mobility Summit that's coming up for free at UC Berkeley, specifically on a summit for leaders in transportation technology, rural aging, and philanthropy. So I'll send out a link to that. There's a lot going on, a lot of information. So just want to say thank you to everybody that participated, but especially thank you to our panelists. Such great information, such in-depth and great knowledge. So we want to appreciate you, and thank you again also for participating next week in our office hours. So I hope everybody has a great rest of their day, and hope to hear from you soon. Thanks a lot.